Hello, thank you for joining us for Unite for Sight's webinar about careers in global health. My name is Jennifer Staple-Clark, and I'm founder and Chief Executive Officer of Unite for Sight. I'll briefly introduce you to Unite for Sight, review the webinar logistics, and then we'll hear from our phenomenal panelists. Unite for Sight is a global health nonprofit organization focused on improving health worldwide. We have healthcare delivery programs that provide care to patients living in extreme poverty. We partner with phenomenal local eye clinics in Ghana, Honduras, and India to provide quality eye care to patients who are otherwise unable to access or afford care. And these programs have provided eye care to 1.8 million people by local doctors during the past decade, including more than 75,000 sight-restoring surgeries by the local doctors. Many of today's webinar registrants inquired about quality international volunteer opportunities. And for those interested in global health opportunities, we encourage you to explore Unite for Sight's Global Impact Corps Volunteer Abroad program. Unite for Sight is the world's only organization that is a healthcare delivery organization that also offers immersive global health education opportunities for both students and professionals. And participants support and learn from the local doctors in Ghana, Honduras, and India as they provide care to patients living in extreme poverty in villages, slums, and refugee camps. Participants in these programs learn from the local medical professionals about patient barriers to care, effective strategies to reach the hardest to reach patients who are otherwise unable to access or afford care, and about best practices in general with public health and healthcare delivery. Several of today's webinar participants also inquired about pre-departure training materials for global health participation, and Unite for Sight also offers these types of materials. We have 70 free online courses as well as certificate programs about all aspects of health and development, including a certificate in global health, certificate in global health research, certificate in cultural competency, among many others. And we also have 2 large upcoming events in New Haven, Connecticut, including our Innovators Forum on Health and Social Entrepreneurship on March 14th, and our annual Global Health and Innovation Conference in April, which is the world's largest global health and social entrepreneurship conference. And all of these courses and event materials and information about those programs can be found on our website at uniteforsight.org. Now I'll describe a bit about the basic logistics of this webinar. We have 1,000 registrants for this webinar, and we're so excited to have all of you on the line, and we're delighted to have you learn from our amazing panelists. We have 10 panelists, and they have a wealth of expertise to share with you during this next hour. Each panelist will give a 2-minute introduction about themselves, their current role in global health, and their greatest lesson learned that they would like to share with today's audience. We'll then dedicate the remaining 40 minutes to questions and answers, and we received many stellar questions already submitted from you, our audience, by the February 25th question submission deadline. We selected the most common and most thoughtful questions to ask our panelists, and we also invite you to submit additional questions in the text box on the left of your webinar screen, and then we'll select additional questions from those submitted during this next hour that we'll ask the panelists as well. We have a phenomenal group of panelists today who will share with you their tremendous insights and expertise about careers in global health. They're all deeply involved in global health and come from a range of backgrounds and interests. Now we'll proceed with having each of our panelists introduce themselves to you. I'm delighted to introduce to you our first panelist, Jean Falk. Jean, please begin by introducing yourself, your background, and current role in global health, and please share your greatest lesson learned from your career in global health. Jean, do we have you on the line? Okay, we had Jean previously, and we'll get him back on the line. We'll proceed then with Douglas Heimburger. Douglas, if you can please begin by introducing yourself, your background and current role in global health, and share your greatest lesson learned in your career.
Very good. Greetings. Can you hear me?
Yes, we can hear you.
Okay, great. So yes, I'm Doug Heimburger. I'm a physician in the Vanderbilt Institute for Global Health. My background is internal medicine and clinical nutrition. I've been an academic career researcher and educator for many years now, and particularly involved in clinical nutrition. My research is in HIV and its intersections with nutrition, so particularly among underweight people, people who are underweight when they start antiretroviral therapy for HIV in sub-Saharan Africa. but my greatest investments probably have been in educating and mentoring young professionals, medical students, but now particularly directing a global health track in the Vanderbilt Master of Public Health degree program, which really gives us a great opportunity to work with lots of developing young professionals. Some of our grants have brought professionals from a number of other countries to Vanderbilt as well for MPH degrees, PhD degrees, and other trainings. So just lots of involvement in education and mentoring. Probably one of the greatest lessons I've learned is that relationships are very, very important, and that by developing relationships with others in cross-cultural situations especially, many doors open and opportunities can be made available.
Wonderful. Thank you so much, Douglas. And Barbara Bush, if you can please proceed by introducing yourself.
Sure. Thanks, Jennifer. My name is Barbara, and I am currently the CEO of Global Health Corps. We founded Global Health Corps about 5 years ago, and our intervention really is focused on talent, bringing young talent to the field of global health, bringing great human capital to the field, really motivated by the idea that great ideas don't necessarily change the world, but great people implementing great ideas do. So our model is one that is focused on recruiting competitively young leaders that are up to age 30 to work within one of our partner organizations. I know Jean is on the line, like Mothers to Mothers, Partners in Health Access Initiative, orgs that are doing excellent work in global health and that can also identify gaps that they have within their organizations. And we recruit young leaders to fill those gaps for a year, while also obviously learning tremendously from the work that is taking place on the ground. And then throughout the year, we invest really heavily in training our fellows, investing in their leadership development and their growth, and connecting them as a really intense, strong network and community, so that this is only the beginning of a career path in the field of global health. And so far, we've been able to work with 322 fellows. We'll be adding 138 fellows to our upcoming class this July. 5,000 people applied for those positions, which obviously speaks to everyone on this phone call and the enormous desire to serve. And our fellows will be working in East Africa, Southern Africa, and also in the United States, because obviously we have global health issues here also. And I ended up working in the field of global health rather serendipitously. I did not study global health. I was actually an architecture student. And my focus really had always been thinking about problem solving and designing solutions for problems. And I was lucky enough to get my foot in the door in global health, working in South Africa and then in Botswana and then in the United States. And since then have been on a pretty straight career path in this field. And I guess two quick lessons that I've learned is, one, that you don't necessarily have to have a medical background to work in the field of global health, and I'm excited to explore this in a little bit later on the call. But I'd say the biggest lesson that I've learned is truly the power of listening and understanding the communities where you're working. Even if you're American and you're working on global health issues in Newark or New York or Boston or wherever you're working, that community may not be your community. And so I think it's most critical as we do this work to ensure that we're listening to those that we're working with and that we're ultimately supporting and serving. Thanks.
Wonderful. Thank you, Barbara. And Jean, if you can proceed to introduce yourself, I believe you are on the line.
Can you hear me now?
Yes, we can hear you, Jean.
You can. Okay. Wonderful. Hi, and thank you all for tuning in here. I'm Jean Falk. I am the co-founder and CEO emeritus of Mothers to Mothers. I had no public health background when I moved to Africa from New York to help get an organization started whose objective was to reduce and hopefully eliminate new cases of pediatric AIDS. I actually was working in television at the time, and but saw a need and thought that some of the experience and skills that I had in growing new businesses would be relevant to a program that a friend of mine was starting to work with new mothers and pregnant women to try to prevent the transmission of the virus from the mothers to the babies. So I picked up and moved and spent almost 10 years there. And during that time, we took a small local operation to the point that it was in 10 countries, in 700 locations. We had at the end, we had a $20 million at the end. I left a couple of years ago, or I guess a year or so ago, but we had about a $20 million budget at that point, and we were seeing over 2.5 million clients a year, including close to 20% of the HIV-positive pregnant women in sub-Saharan Africa. So my experience was completely as a newcomer, and my biggest lesson that I'd like to pass along, and I will say up front that I'm a bit of a contrarian when it comes to many traditional public health issues, because my experience was that ignorance was bliss, and we were able to build a program that not only had a direct impact on hundreds of thousands of women and children, but also became a model that the UN adopted as a best practice and as a centerpiece of their program to eradicate pediatric AIDS. And we were able to build it because we didn't know what we weren't supposed to do. My business partner was a doctor and a public health person, but he had only worked on a small scale. And as we went to expand our operation, we just kept doing things that made sense or that were common best practices from the business sector. And later on, we were told that's not how you should be doing it, or how did you manage to get away with that? And we sort of looked at each other and said, wow, aren't we glad we didn't know that at the time? So there's me and my lesson.
Great. Thank you so much, Gene. And we'll proceed to Brian Heuser.
Hi, can you hear me?
Yes, we can hear you.
Wonderful. So I'm Brian Heuser. I'm a faculty member, primarily at the Peabody School of Education and Human Development at Vanderbilt University. I also have an affiliated faculty position at the Vanderbilt Institute for Global Health. And I came to the world of global health sort of kicking and screaming, to be honest with you. I did an interdisciplinary doctorate that was focused on administration, international education, and economic development. I spent a good bit of time developing curricular programs for both a graduate program and an undergraduate program here at Vanderbilt. And the more and more research that I did on education, both as a practitioner but also as a scholar, I realized that I could no longer ignore these profound, both empirical, qualitative and quantitative connections between education policy and health policy, but also between the provision of health and the provision of education. And so many of the studies that I've been using in my scholarship and in my teaching over the past few years have focused on these intersections and the very strong reciprocal linkages of these connections. So I've decided over the last couple of years to refocus part of my scholarship, in fact, very deliberately and pointedly at these intersections. And I would say I come to global health very humbly, and I'm learning a lot all the time from my colleagues at the Institute for Global Health, but also the many colleagues I've met through Unite for Sight.
Wonderful. Thank you so much, Brian. And Vanessa Carrie, if you can please introduce yourself.
Hi, I'm Vanessa Carrie. I'm the founder and CEO of Seed Global Health. We're an organization that sends U.S. doctors and nurses abroad to be medical and nursing educators. We partner with the Peace Corps, so these individuals go as Peace Corps volunteers, and they serve as faculty for 1 year to help train a new generation of doctors and nurses indigenous to the countries where we work, who will become the leaders of their country and hopefully help build the national health strategies of their country in a sustainable way. We see this as a force multiplier, where one individual that we help teach can go on to teach many more for years to come. We also provide loan repayment stipends to help our volunteers be able to serve, because many health professionals carry large amounts of debt, which can take years to pay off, which I can attest to, having just started to retire my own loans. And we help them do this by raising the funds to support them through stipends that allow them to be able to engage in service and participate in a program like this. And then one of the other things that we do now is we try to help build additional investments in the environment and institutions where they're working, so that they have the teaching tools and the support they need to be more effective, that their counterparts have the support they need to do the jobs that they're intending to do. There's continuing medical education options. There's advocacy happening at the level of the countries around human resources for health to help scale up. And really this was, it's funny. I've heard a lot of people already on this call talk about the serendipity of where they ended up, to use Barbara's word, and sort of how they came into this kicking and screaming, in other words. And I wouldn't say it's been quite like that, but it wasn't exactly a straightforward path either. It was a constellation of realizing that I was very interested in training as a doctor, because it fulfilled a very fundamental need of helping other people for me, but combined my dorky interest in science. And then it really grew up with, my mother grew up abroad in a lot of other exposures to sort of a big world that made me realize there's a huge amount of need. And it was very stark, the degree of need in parts of the world, which is not unique. Many countries, including our own, have that. But it seemed like this opportunity was sort of a constellation of my interests. And then when I was training in residency, I realized that there was a huge amount of energy and interest in global health in this country that didn't really have an outlet or meaningful partnerships with which to sort of be embraced. And so people were going and spending 2 weeks here, 2 weeks there, doing meaningful work, but which sort of dissolved when they disappeared. And so I realized that there was so much need, there was a huge amount of energy and interest, and there had to be a common way to bring these two things together, and that's how Seed Global Health was created in its inception. I think that the lessons that I've learned along the way are, one, there's no straight path. Life tends to be a zigzag, and it tends to be a little bit of discovery and picking up the pieces and figuring out how to persevere among great challenges. And I think that is true sort of anything you do, but certainly in global health, where oftentimes the best of intentions you can discover sometimes need to be reworked. And I think that speaks to the second lesson I've learned, which is the incredible importance of partnership and collaboration and patience. Really understanding that you're there to help meet the priorities of those in the community where you're working, and that it is very important that you do that together, and that each partner brings strength to the work that you're doing. And I think that that can be incredibly important. And then I think that it really is going to it takes a lot of unified effort. There are many other programs that do similar complementary work, and our job is to help feed into that bigger network so that we're all tackling the challenges in unison.
Excellent. Thank you so much, Vanessa. Charlie McCormick, if you can introduce yourself next, please.
Great. Thank you, Jennifer, and congratulations to you and all the Unite for Sight team for pulling together and the great work that you do. I have been working in global health and international development for literally decades, as it turns out. I was an undergraduate at Middlebury College, and there was a great focus on international studies and languages and so on here, and that directed me in this general direction. Went to Columbia for a PhD, which was essentially in international development, and while there was the assistant dean of something called the International Fellows Program, which brought together graduate students from different disciplines around global development. And the disciplines included the medical school and the School of Public Health, as well as the business school and so on. So early on got a view of how global health and other professions linked with each other. I was the founding dean of the master's degree program at the School for International Training, where global health was an interest of many of the students, and also directed Peace Corps training groups to Thailand and Ghana that were going to be in public health, and on it went. I spent 19 years as the CEO of Save the Children, where we annually reached about 180 million children and mothers with health and education, and I am currently the executive chair of the Millennium Development Goal Health Alliance, executive in residence at Middlebury, where I was, as I said, an undergraduate, and senior fellow at Interaction, working with their members that are in the global health sector. So I've seen global health from a lot of different directions. One of the things that I've learned is that persistence really pays off in results. That I've seen lots of people smarter and harder working than I've been, but as I suggested, I stuck with it over the long haul, and you do gather alliances and connections and understandings over time that you don't get if you're in and out. And on the persistence theme, that you need to fail forward. Every day has its frustrations, and many initiatives don't come to immediate fruition. But if you stick with it and don't take no for an answer and outlast the opposition, you'll get the results you're looking for. So thanks.
Terrific. Thank you so much, Charlie. Marie Martin, if you can please introduce yourself.
Wonderful. Thank you for being here with us. My name is Marie Martin. I'm the Assistant Director here at the Vanderbilt Institute for Global Health and Associate Director of our Global Health track in our MPH program. So much like the others on this call, I don't have a background in public health or medicine, but rather in international education, policy, and management. And I've been developing curriculum and academic programs for nearly 15 years, both in the U.S. and abroad. My first experiences were actually in the Czech Republic, where I taught English, and then have subsequently worked in the U.S. and in other places developing educational programs. My master's is in international education policy and management here at Vanderbilt, and my doctoral studies are in health policy and public policy. So much of my work here at the Institute for Global Health is actually focused on capacity building, and that's done at 3 levels. One at the individual student level, to help students become effective practitioners and leaders in global health, acquire durable competencies, develop strong toolkits. Also at an institutional level here at Vanderbilt, building high-level training programs in global health, enhancing and expanding our own expertise in leadership and management, ethics, research, and whatnot. And then also at a low and middle income country level, building capacity on the ground to effectively tackle health issues domestically, opening up new possibilities in training and education. So I think that the lessons that have been shared on this call are fantastic, and I would just add to that, that being that you need to identify your own unique niche in global health. There are so many different paths that you can take, and identifying your interests, your inherent strengths, and concentrating on enhancing your skill sets and developing new competencies in a way that you individually can contribute in a meaningful way would be my lesson.
Terrific. Thank you so much, Marie. Troy Moon, if you can please introduce yourself.
Hi, good afternoon, everyone. My name is Troy Moon. I'm a pediatrician with subspecialty training in infectious diseases, as well as a master's in public health in both international health and epidemiology. I'm currently on faculty at the Vanderbilt Institute for Global Health, and most recently served as the in-country clinical director for a Vanderbilt project in Mozambique, related to HIV program scale-up in that country that was funded through the U.S. government's President's Emergency Plan for AIDS Relief. Recently, I returned to the U.S., and in my current role at Vanderbilt, I still provide technical assistance and support to the programs that we have implemented in Mozambique, but really have focused my time and attention related to teaching within our public health program, as well as mentoring of students, and also engagement in projects related to capacity building within Mozambique, within their own medical education and their public health training. I would say that probably I agree with all of the lessons learned that have been shared here today, but in an attempt not to repeat what has been said, when you think about implementing programs on the ground, attention to detail, especially related to logistical issues, can be just as important as any technical skill or program implementation skill that you can bring to the table, as well as patience and flexibility. So thank you.
Excellent. Thank you, Troy. And our final speaker from Vanderbilt, Dale Savage, if you can please introduce yourself as well.
Hi there. I'm Dale Savage. I am delighted to be on this call with all of you. I'm an educator and practitioner in the areas of leadership and organization performance. I have a dual role here as faculty, and I started a career service center here at Peabody College at Vanderbilt. I've worked in healthcare for many years with clinical leaders and was the local chief learning officer for a national health care organization. I would say the biggest lesson that I've learned is the power of your network. I believe that your network is only as powerful as how often you activate it. We are doing a lot these days with social media, particularly in LinkedIn. It is one thing to invite someone into your network. It's quite another to learn how to use that person in your network. So I ask, what are the questions you're asking? What do you need to ask? And how do you reciprocate the information to the people with whom you are inquiring? It is a back and forth, yin and yang proposition that is very important. And when you invest in the potential of others, each day is a delight. Thank you.
Thank you so much, Dale. And our final panelist, Richard Skolnick, if you can please introduce yourself.
Thank you very much, Jennifer, for inviting me to join you and to join as well such a distinguished group of panelists. My name is Richard Skolnick. I'm now a lecturer at Yale, where I teach global health courses, if you can believe it, in the college, the business school, and the School of Public Health. I'm an old development person who got into this field after wonderful experiences as a high school exchange student in 1966 and 2 programs from Yale University that allowed me to live and work in the Philippines and Hong Kong long before such opportunities were common. I joined the World Bank through its Young Professional Program in 1976 after doing my undergraduate studies at Yale and doing graduate work in development at Princeton. I spent 25 years at the World Bank and left in 2001 as the Regional Director for Health and Education for the South Asia region. At the bank, where I had a wonderful career, my most important work focused on the health of poor people in South Asia, including efforts on maternal and child health, HIV, TB, leprosy, blindness control, and health systems development. In addition to my work at the World Bank, I've also taught global health at the George Washington University, served as executive director of the Harvard PEPFAR program, and been vice president for international programs at the Population Reference Bureau. I've also had lots of opportunities to be involved with the technical review panel of the Global Fund, a couple of international evaluations, some work on polio, and a great deal of work on TB. Now I'm devoting all of my energies to education on global health and really nothing else, if I can help it. As you think about a career in global health, the most important thing I can tell you is identify early some role models, people you think you want to be like, and then surround yourself as much as possible with good mentors, people who are more knowledgeable and wiser than you, and from whom you can keep on learning. Again, thank you very much for allowing me to join you.
Thank you, Richard, and thank you so much to all 10 of our panelists. As you've heard, they have such a wonderful range of expertise and backgrounds and so much to share with you today. We'll proceed now with the questions that have all been submitted by members of our audience in advance, and you can also, as I mentioned earlier, submit additional questions in the box on your webinar screen. our first question is for Barbara Bush. In general, do you see specific skills that typical young global health professionals are lacking? What skills are especially beneficial for students and young professionals to focus on, and what type of unique skill sets can be especially beneficial to the global health field?
Great. Thanks, Jennifer. I think what really surprised us initially when we started Global Health Corps and we started partnering with the organizations that were going to accept our fellows for a year to work on their teams. And those organizations were nonprofits ranging from large organizations like CARE to grassroots organizations to ministries of health in Rwanda and Malawi and Uganda. When we first started partnering with those organizations, the majority of them did not request traditional medical backgrounds. They didn't request doctors and nurses. What they were interested in were young, smart, talented individuals that could help them build systems. And that was really exciting to us because then it could really open up the field of global health to almost any skill set if it did contribute to systems change. And so, for example, a number of our Global Health Corps fellows have been working within ministries of health on strengthening the drug supply chain system. So one of our very first fellows, Amit Salvi, who was in our first class, he had formerly been working for the Gap and for Restoration Hardware, and he was an engineering major and had used that major and that background to work on supply chain for enormous corporations and stores throughout the U.S. And when he found out about Global Health Corps and saw our postings for supply chain management skills, he realized that the skills that he had gained from working for the Gap, where he was specifically getting jeans from warehouses into Gap stores across the United States, those skills were completely relevant and tangible to doing the same thing in Tanzania, but instead he was working on getting drugs from warehouses into clinics and then obviously more importantly into the hands of the patients that need them most. So I say that as an example because we've seen over the past 5 years many of our fellows have skill sets they wouldn't have seen fit into global health. We have 10 fellows in Rwanda who are architects, and they're redesigning the way that air flows throughout health clinics so that tuberculosis, which is airborne, will not spread to everyone that walks in the door. And so by highlighting systems change, I think it becomes clear as to what Marie was saying before, these niche-type skill sets can be applied to saving more lives, while also obviously getting different skill sets at the table means that there's more ways of thinking and diverse outlooks and diverse thought processes around how we can iterate upon solutions that exist or make them more effective because there's different viewpoints thinking about them.
Thank you, Barbara. That's such fabulous insight. And the questions that we have today really range from queries from the audience members about skills and experience to questions about degrees and job advice. So we'll go through quite a range of different questions for the remainder of this webinar. Our next question is for Richard Skolnick. What are some common misconceptions that you have seen about building a career in global health? And what are some common attitudes that you find misguided? And what key advice do you share with your students to avoid common pitfalls?
Thank you, Jennifer. One common misperception I think that students have is that they have to know, even when they're in college, exactly what they want to do and exactly how they're going to do it. As my friends say, however, much of what we worked on did not even exist when we were in college, such as HIV, the global program for the eradication of polio, etc. So I tell my students to stop trying to plan every minute of their future and gain instead a good general mastery of global health. I also tell them to learn what are the most important questions that need to be answered in different settings if they want to be an effective player in global health. Hopefully this will both help to prepare them better and also relieve an enormous amount of what I think is unnecessary and self-induced stress. Let me give it back to you. Thank you.
Thank you, Richard. And actually another question that was just submitted a few minutes ago that I think is a great question for you. Are there any books or resources that the panelists you would recommend to current college students to become more knowledgeable about global health?
Oh, I think you have to answer that one, Jennifer. I mean, since I wrote one of them, I don't want to talk about it. But no, I think there are a number of resources that I recommend to students. One is, if they're not very familiar with global health, I think a good introductory text would be very, very valuable, and there are several, and courses are using them. But then in addition to that, I think for any student who's able or willing to go a little bit beyond the basics, I would also encourage them to read the most important reports every year on AIDS, TB, malaria, Mother's Health, Saving Newborn Lives, as well as the most important Lancet series come out. I think if students can read the basic tests, read those Lancet series, read the basic reports that come out, they will, in a term or so, have a really good grounding that when coupled with some good experiences will really give them excellent preparation for pursuing their interest in global health. I hope that's a fair answer. Thank you.
Terrific. Thank you so much for your guidance on both of those questions for the audience. Our next question is for Marie Martin. Students and young professionals interested in getting involved in global health are often stuck in a cycle in which they need to have experience to get experience. How can they break this cycle?
This is a great question and a terrible conundrum, and many times I find myself speaking and working through this issue with students in our undergraduate colleges. So my recommendation is to be focused in your search, and first and foremost, identify your own interests and the kinds of experiences that would build and hone your particular skill sets. Just as Barbara mentioned and others, recognizing that this is an interdisciplinary field, it requires individuals from a diverse with diverse sets of backgrounds in order to solve these entrenchable global health issues. And so recognize kind of your place in the broader spectrum of global health. Some other things, though, that you can think about doing is considering unpaid internships and volunteer opportunities, good opportunities to expand your networks, as Dale mentioned, and take advantage of experiences that you might not otherwise get if you were looking for entry-level paid jobs. Explore local organizations. Think about how you can build your skill sets and experience working in low-resource settings and with underserved populations in your own city, foreign-born and otherwise. Consider great opportunities like the Global Health Corps, and we've heard about that in this call, and others like the Peace Corps, AmeriCorps have health-related opportunities and can really develop critical competencies that will help you to be more effective in global health. The CDC, WHO, and others have fellowships for those directly out of undergrad or those who don't have as much experience but are looking to spend a period of time developing their skills. Attend conferences like Unite for Sight, Network, and then obviously advanced degrees are great. And in our program, for example, we offer the flexibility of an 8-month practicum. And so when students graduate, they have both the didactic experience from the classroom and then an extended experience in the field where they really develop competencies that make them as effective as they can be to be practitioners in global health.
Thank you so much for your insight on that. And Brian Heuser, as a student or professional with a limited skill set, what are good ways to get quality experience abroad and make an impact?
Well, I think Marie said just about all of it, but let me give you a few. I want to say first of all that and draw on something a couple of the other speakers have said. It first requires a good mindset. I think that, and I think I share this with many of our colleagues, some of us are kind of offended when students' expectations aren't right-sized. The notion of students thinking that they can go wherever they want in the world and work on people, as it's been put to me before, is offensive. And it's wrong, right? It's offensive and it's wrong, and I think we should call that out when we have the opportunity to do that. That being said, the first thing I always try and do is right-size my students' expectations. The second thing I do is I do exactly what Marie said, which I send them to internships with well-established organizations where I know that there's some kind of structure to those internships and some kind of reflective activity on what the nature of those internships are. Hopefully there's a lot of reciprocity in those and that's filtered up. Also, well-run volunteer programs with good organizations, short-term academic programs, and I would also say Unite for Sight's global health universities, webinars, et cetera, absolutely. The one thing I would add is I think, and we talked with some leaders in global health about this not too long ago, get on the job boards. Get on as many job boards as you can, DevX or USA or whatnot, and actually review the postings of jobs and take a look at the careers that are most interest to you. Pay special attention to the skills and capabilities that they mention in that, and then seek those out. There are so many ways of doing this, right? And I can deal with some of those later. But like Jean said, there's also Management Sciences for Health. There's USA, World Health Organization, IHME, incredible databases and publications made available for free or very low cost.
Excellent. Such great advice. And Dale, what are the benefits of taking time off after undergraduate and working versus going straight into a graduate program? Do you find graduate students to be more prepared if they have past work experience?
Well, from my experience as a career professional and someone who directs a graduate program, I do see the benefit of at least one gap year of experience post-baccalaureate. And my reason for this is really driven by context. I think without a context to test one's assumptions around issues in graduate schools, one has a very limited scope with which to view the innumerable answers to very complicated questions. So granted, I have seen very successful students do well entering a graduate program following their undergraduate work. However, the student with the experience, a different context, a different mindset, and an intention to study the subjects in one's program seem to excel greatly.
Wonderful. Our next question is for Jean Falk. Most colleges do not have a public health major, and we actually received several questions from a variety of students who are wondering about possible post-college career options in global health for those who have not specifically studied public health in college. Jean, I know that you have a lot of insight about this. Is a public health major or past public health classes necessary to enter the field?
Well, I think you heard any number of approaches to this, and I agree with absolutely everything everyone has said. My first note when I heard this question was to think exactly about what I'm afraid I've lost track of who's speaking, but someone said earlier about expectations. Yes, I've heard the same thing, that what I want to do is go and help people, or I want to be in the field. It's like, well, what skills do you have, and why would you think that would be a productive thing for anyone? And there usually is not a very good answer, but there's usually a lot of enthusiasm. That is where the problem comes in, when the enthusiasm and the expectations are completely out of line with practical reality. But there are ways, plenty of ways, you can get into public health without having that kind of a background. And it depends on what you want to do. Certainly if you want to really pursue the classical public health kinds of positions, then you're going to need at some point to have that training. But on the other hand, organizations need lots of different kinds of people. And so if you find a way to make yourself useful, that would be the first thing I would suggest. Many organizations need help with communications, with PR, with finance, and I can go on forever. And they would be delighted to, in exchange for some of your time, they would be delighted to let you do that kind of work and also give you exposure to what the main part of their service delivery programs are. But you need to know what you bring to the table and how to make yourself useful. I would also say that smaller and more, I don't want to say more innovative organizations because I don't want to draw that line, but smaller, innovative organizations, newer organizations tend to be very open to smart, warm bodies. In other words, if you're competent and you can do it, then they might be more inclined to hire you. Certainly that was our approach for many years, that we got people out of a number of programs like Princeton in Africa and other college programs who had no background in public health, but who were extraordinarily capable and competent, and we found amazing uses to put them to. And so that's another way of looking at this is, well, how do you get in? There are so many organizations that provide that kind of path. I mean, Barbara's organization is a fabulous example. Many colleges and universities have fellowships, if not full programs, where they take people who are gifted students and leaders and practitioners in other fields and allow them to find themselves an opportunity in the field. And I think all of those ways are ways in the door, in addition to everything everybody else said. The more you prepare yourself, the better off you'll be, and that's where a number of the earlier speakers laid out good ways to do that too.
Excellent. Thank you, Jean. And Barbara, that's actually also a perfect question for you, and I know you've already touched a bit on it, but do you have any additional thoughts on this topic, and also how best can college students engage in quality global health experiences outside of the classroom?
Yeah, absolutely. And I feel like there's already been such great insight into this that I don't want to repeat. But I think a few things. As Jean was just saying, organizations that are working on global health issues, they're working on global health challenges. That's one piece, but they're also organizations. And so our team primarily is not made up of people that have global health backgrounds, but they're helping us build a newer organization. They're helping us build out our own systems. And so I think it's important to think both of what issues you're passionate about in global health and learning as much as you can, but also if you're still in college, you can also work within an organization in wherever you are so that you can hone your own specific organizational type skills to understand the different organizational cultures and different ways of operating so that when you do graduate, you are ready to hit the ground running within another type of organization. I'd also say, and I'm going to embarrass Jean, but I met Jean probably 10 years ago, the year that I graduated from college, and I was living with some folks in South Africa that were the Princeton in Africa people that he was referring to that were working within Mothers to Mothers every day. And I think what was really interesting to me when I was younger, and still is, I mean, I still am learning a ton, is to talk with people that you think are doing great work and understand and ask them about the career choices and decisions that they made, because that's just additional insight and additional life years that you, too, can figure out how you can apply to yourself. So I think I've always been fascinated by Jean's own decisions to pursue something that he was passionate about, but wasn't necessarily the same path that he might have considered that he would have when he was 22 years old graduating from college. And then lastly, Marie already said this, it's that there are global health issues in the United States. So I think it's really important to think about issues and challenges that exist in your own, if you're on a college campus, in your own university. And if you specifically want to be thinking about it with a global mindset or a multicultural mindset, you know, there's refugee communities throughout our country, there's immigrant populations throughout our country, and figure out how you can be part of the solution where you are and gain firsthand skills where you are, which can be applied in a variety of other ways throughout your career.
Excellent. Such terrific thoughts on this topic. We also received a lot of questions about graduate degrees, and our next question is for Charlie McCormick. For those interested in global health, is an MPH enough, and is an MPH even necessary, and also is an MD important?
Well, I think we've learned from all the speakers that there's no one track, and an MPH and an MD are certainly not necessary to a career in global health. It really depends on what role one is aiming towards. But first and foremost, graduate degrees help because they allow more options. If you're going to be an entrepreneur and so on, not necessary. But in general, particularly for people starting out, you just can't know 10, 20, 30 years forward exactly what you might want to be doing. So the degrees and the experience combined just allow for more different kinds of options. And obviously, if you want to be in the academic side of global health, then an MD and a doctor in public health and so on and so forth is really key. If you want to be on the management side of global health, then obviously an MBA or a master's in public administration helps. If you want to be on the technical side and the planning side, then a master's in public health definitely does help. So it makes a huge difference what kind of career you want to pursue and what part of global health you want to be in, what kind of graduate degree makes the most sense.
Terrific. Thank you, Charlie. And Troy Moon, have you found that it's necessary or helpful to have an MPH in addition to your MD in order to work in global health? Do you apply skills from both degrees to your daily work as a pediatrician focused on infectious diseases?
Well, I guess a lot of what I would be saying is necessarily a reiteration of what the other panelists and specifically what Charlie just mentioned. There is, as he said, there is no specific one way to get to a successful career. For me personally, I do know many persons with either an MD degree or an MPH degree by themselves that have been very successful in the activities that they've done in global health. But I would say that for me, the MPH has allowed me to have the options, as Charlie just discussed, to explore a variety of different activities. So yes, I am a pediatrician with infectious disease training, but there are many things that I have engaged in that are beyond just the typical clinical pediatric infectious disease type career. The MPH for me also, I think, is advantageous in the fact that it gives you that global perspective and contextualization, or it allows you to, one mechanism of gaining that contextualization, along with some specific skill sets that maybe my MD degree would not have trained me on by itself. And in that sense, I'm talking about some of the evaluation skills for program implementation or research design and how to put together a study and analyze the results of a study that I may not have gotten so easily with just an MD degree. But so it's not necessary, but I have found it very helpful to have both.
Terrific. Thank you for your thoughts on that. Our next question is for Douglas Heimburger. You recently made the move from domestic health to global health. What advice do you have for people who are further along in a career but want to transition into global health or into something different that they have not previously been focusing on?
Yes, thank you for that question. I think it's a logical follow-on from the discussion in the last few minutes because indeed, there is not just one path into global health, and I represent someone who really worked for 25 years with a domestic focus and really felt as though I really needed and longed for a new challenge, both to keep myself sharp as well as to apply my skills that I did have in a different setting. So. But it's not easy to do. If you've been well entrenched in a career for 25 years, then really making a significant shift is not easy. So I would say first, don't be bashful and don't just try to suppress those those rumblings within you that really, is there something else for me? There's actually a lot of literature on mid-career shifts and how one can be more effective by making such a shift sometimes rather than just keeping on for another X number of years, 15 years or whatever. So explore opportunities. Don't be bashful. I'll pick up on a theme that Barbara mentioned earlier and give you one of the mantras that I give to our students a lot, and that's connect the dots. I think she was describing that if someone has supply chain skills then and has done that, has used them in industry in the U.S., those are very useful in global health settings. And I think there's a huge range of skills that people might have and have used domestically that can really be well utilized in a global setting. So don't try to reinvent yourself entirely, but make sure you're connecting the dots between your past and your present into a new future. And then the other thing, I would go back to the idea about relationships and networks. One of the things that a person who's well into their career has typically gotten pretty good at it and is a network. So utilize your current networks and see how those can be expanded. I'll give you another one of the mantras that my students roll their eyes at, and that's nothing beats showing up. So visit some places, even if they're very peripheral to your network. Go out and pay some visits and ask some questions and see what opportunities might be there.
Great insight. Our next question is for Vanessa Carrie. On the path to becoming a professional, there always seems to be a next step. For a doctor, it includes undergraduate, medical school residency, landing the best job possible, proceeding as a physician. At what point along your series of steps did you make the decision to pursue a different next step, or did the opportunity just come to you?
I think that my path, I think there's always sort of throughout my career, there's always been interpoints or intercalations where I've sort of taken a different path. So when I left college, I actually took 2 years off before I went to medical school, and I spent a year, quite candidly, working on a ranch and for a photographer and living at home, saving money. And then I took the next year to sort of explore and sort of use my savings to go out and see more of the world, which really which solidified for me my commitment to medicine and my commitment to global health. But it was 2 years that were very unconventional for someone going to medical school. But they were important for me, and this was spoken about earlier about taking a gap year, because I think that there is an opportunity to kind of grow and take a break from that constant path and that constant pursuit of the next step, which I think gives you perspective and gives you a little bit better sense of what you want to do, because when you make the decision to kind of get over the inertia and go back to do something, you want to feel really good about it. It also gives you some room to really explore what you're good at and what your interests are and where you think that you'll really excel. And then when I went to medical school, I didn't do medical school in 4 years. I did it in 6. It was for a combination of reasons that a lot of it had to do with family, but I also took the time to get my master's in health policy planning and financing, and actually decided to do that abroad because I thought it was incredibly important to get an exposure to a different view of sort of health systems in the world, and also to be really surrounded by an international colleagues that could help change my perspective and from whom I could learn. Finally graduated medical school and went into my residency, did do my residency in one solid track, but then again took a year before I went back to fellowship, and it was during that time that I started Seed Global Health. And as we started Seed and I realized I wanted to go back to fellowship, I ended up finding a way to do a part-time fellowship in order to complete my clinical training, but to still continue to develop Seed. And I think that, probably it depends on, this goes back to the big conversation of it really depends on what you want to do. Because you could stop after medical school and say you've gotten some exposure to the disease processes and that's enough of what you need to be able to go on and inform your work. Some people would say, I want to do residency because I really want to understand the experience of patient care and how the health system works and to get some sense of the direct, ability to be a provider. I think what is the most important thing, because no matter what path you take, whether it's a PhD or an NPA or an MPH or finishing after college, what's the most important thing is that you always take the deep breath and ask yourself, what do I really need next to do the things that I want to do? And you may not know what you want to do, but you should ask yourself, is this something that is this in my journey to figure out what I want to do? Does getting this higher degree or taking this next step make me happy? Am I going to enjoy the process of doing this in a way that even if it doesn't lead me or I don't, it's not a direct step to what I want to do, I will gain skills or have an experience that I think is going to serve me well. Because what I wouldn't want to see is people go do or pursue a career path where, they're sort of doing it because they think it checks a box or they think that they need to do it. There really is no one path. And there's such a great need across such a diverse areas. You could be an architect and you can design a really smart building that has better ventilation that helps prevent TB transmission, or that has a more eco-friendly approach to providing care and to the hospital environment that actually is better for the surrounding community. So there's immense ways for people to contribute. I think the important thing is that you're always honest about what makes you happy and where you think you're really investing in your particular skill set, and that I think honestly you also have the courage sometimes to break off that path when you think it's right for you, which sometimes can be very hard but incredibly important.
Thank you, Vanessa. It's such extremely important advice. And we have time for one more quick question for Dale Savage. What are some common pitfalls that you see in job application cover letters and resumes among students that may not be obvious to the applicants as they're applying for a job in global health?
I love this question, and I did it in a top 5 list of pitfalls, so I'm going to start with number 5. What people don't do is they don't align their past achievements with the present position to which they're applying. Employers want to see and read that your past experience will help them solve their problems today. Number 4, your resume does not contain any result-oriented or achievement statements. What did you increase? How many members did you serve? Quantifiable results are very important to illustrate on your resume. Number 3, please don't regurgitate your resume in your cover letter. Assume that both will be read to learn more about you and your experiences, your knowledge, your skills, and your abilities. Number 2, applicants sometimes do not acknowledge their interest in the employer in their cover letter. They talk only about themselves. They don't make any effort to acknowledge that the mission of this organization aligns perfectly with their own personal mission. And of course, number 1, and we'll get everything thrown into the trash, are misspelled words, medical errors, and poorly written documents. That's all I've got.
Okay.
Thank you so much to all of our panelists for just your amazing, phenomenal insight and expertise today. I hope that our audience has learned a lot from all of you. And thank you so much to our panelists and to our audience today. Thank you.
Thanks for letting us be a part of this.
Yes, thank you.
Thank you.
Vanderbilt says goodbye.
Thank you so much. Bye.